Jesse Hidalgo here with Hearing Group. Thank you again for joining us. Today we're joined by Dr. Hileman, or Brandi, we refer to. So we kind of wanted to pick your brain this time about hearing instruments and maybe some of the myths that kind of circle around those.
Okay.
One of the very first things that we hear all the time is that hearing instruments are just for old people. What do you think about that?
Not the case. Hearing aids are for everybody. I'm going to be honest, I don't feel like I'm old, and I wear hearing aids myself. And I'm seeing in the clinic and in the office, patients are getting younger and younger.
You know, it's so funny you say that. It seems, we've both been in the business for over 20 years. Mm-hmm. And so we've been around the block a little bit. We've kind of seen a lot of different patients come through our doors, right?
Right.
And I remember over 20 years ago that the average patient that came in, they were older. Mm-hmm. There's no doubt about it. When you look at them, they're just older. But the average patient that's coming in today is definitely not that person. Right? And so we're getting a lot of the working class. People are still in their 50s and sometimes their 40s and 30s that are coming in. Mm-hmm. And so we're seeing that just all the time flowing through all the practices. So hearing loss affects people of all ages, obviously. So it's just a matter of whether a person's actually doing something about it or not. That's a big determining factor. So I think that kind of solves that first one.
Yeah.
We just killed that myth, right?
Yeah.
All
myth
right.
busted.
Myth busted. I love that. So the second myth that we wanted to address is hearing aids are eyesores. Well, in working in the business for a long, long time, honestly, they can be, right?
And they used to be.
And they used to be. And so, is that so much true anymore? And what determines whether it's an eyesore or not?
Not true anymore. I mean, there's so many different styles, color options. If you're wearing it properly, then it shouldn't be an eyesore. Sometimes though, if you don't have it in all the way, then it might be pretty noticeable. But if you've been educated and see your professional on a regular basis, hearing aids they're not eyesores. Most people have no idea.
In fact, one of the nice things that some of the manufacturers have really done is they've created a variety of different colors, mm-hmm. some that match the skin tone, some that match the hair, some that are just trendy. Mm-hmm. They just have different colors.
Right.
And my wife, as you know, Amy, she wears hearing instruments, mm-hmm. and still to this day, her favorite color was ruby red. Mm-hmm. If a person doesn't have it properly inserted,
yes,
then obviously it becomes noticeable that there's something that's maybe in their ear that's not quite right.
Yeah. What
What happens if a person is maybe not having them in properly all the way? What should they do?
They should go back to their professional, and we're there to help you. We'll show you again how to put it in. We'll let you practice while you're in the office so that we can make sure you're getting it in properly, and show you some different techniques, because there are different ways to put them in, and not everybody does it the same way. And there's not a wrong way or a right way. It's just making sure you get it in all the way.
All right, so there's two. Number three, hearing aids will make everything around me sound too loud. Could that be true?
It could be true if they're not programmed properly, or you haven't had a hearing test, or depending on what you purchased. If you've bought something at Walmart off of the shelf that's an amplifier, it is going to amplify everything around you. A hearing aid though has lots of technology in it that we can program to make it suitable for your lifestyle and the different environments that you're in on a regular basis.
Yeah, so you make such a great point there. There's two different types of instruments that you can actually get. You can get one that you can get what we call over the counter, or something you can just buy off the shelf, mm-hmm. something you can buy online, something that you can go through and just put inside your ear, and that one fitting is expected to be the grand scenario for everything. In that kind of scenario, yeah, it can be too much, right?
It can be.
Yeah, and so what's the other scenario again?
The other scenario is to come in and let us do a hearing test, find out exactly what your hearing loss looks like, and then we can talk about your lifestyle and, if you're still in the working force, if you're at home and retired and doing, golfing, bowling, whatever, and we'll find something that works for your lifestyle, and we'll amplify where you need amplification.
Now, even if they go to a hearing professional, could that myth or could that scenario be true that hearing aids just make it too loud?
It could be,
Yeah.
if it's not programmed correctly. But the patient also has to come in and be honest with us and let us know, okay, I'm having troubles in this situation, or it works great here, but when I move to this environment, it's helping, but I'm still struggling. You have to be honest. You have to come in, call us, make an appointment. That's what we're there for, is to help you get that hearing aid program so that it works best for you.
So another one is, I don't need hearing aids because my hearing isn't that bad. What do you think about that?
Well, how do you know your hearing's not that bad? Again, we're going to go back to getting that hearing test so we can find out exactly what your hearing loss is. And the thing with hearing loss is that it's usually a gradual process. So you don't really know how much loss you have because it's happened slowly over time and you don't realize you're missing out on things. So by us being able to do the hearing test and determine where you're at, we can decide how bad is that hearing loss, and then we can proceed from there.
So there's one aspect. The other thing we always look at is the brain's ability to understand speech. Tell us a little bit about that.
So we want to know, how well your brain discriminates speech sounds. We want to keep it stimulated. We want those sounds coming in. And when you have a hearing loss that's gradual over time, the brain is not hearing those different sounds and it forgets what it's supposed to do. So by doing the hearing test, we can see where your loss is and what help you need so that we can keep the cognitive ability of your brain functioning and working.
And that's so important, because we need to keep the brain active. And I always refer back to that phrase, if you don't use it, you lose it, right? And so that's the number one reason why we want to go through and do the whole battery of tests, right? Do a comprehensive hearing eval for the person.
And the other thing is that there's a link between hearing loss and dementia and Alzheimer's. So we want to find out as soon as possible that there's loss, re-stimulate the brain so that we can slow that cognitive decline.
Yeah, and so I think there's a lot of neat research out there. Johns Hopkins University is one of the founding ones that came up with that study, and it's still a great article. So great, thank you very much for that. So another one is that hearing aids are too expensive. What do you think about that one?
Well, hearing aids are expensive. They can be expensive, but there's a ton of technology inside that little device that sits behind your ear. There's a lot of research and development that goes into the process of building that hearing aid. So, they are expensive, but they're doing a ton of things in a matter of milliseconds. So they're expensive. But there's something for every lifestyle. There's different technology levels. There's something for everybody.
Yeah, and so when you think about hearing instruments, there's a couple different things that come to my mind. One is there's definitely a difference in the way that they are built.
Yes. As
far as longevity. So what may appear to be the same thing on the outside, when you look at the long-lasting effects, who's going to last longer, what hearing instrument is going to take you the long haul, there's definitely some differences there. So just because feature-wise they may seem to be the same, that doesn't mean that it's going to last you for years and years and years, right? And so there's one. The other aspect in regards to cost is, are you working with a hearing professional or not? Well, there's definite advantages of working with people like you, working with a doctor or an audiologist or a hearing instrument specialist, because they're bringing, as you have been in the field 20 plus years, they're bringing all that knowledge, right? And so that comes at a cost, and so it really kind of depends on what you are looking for. As you mentioned, we do have hearing instruments that do run less. So we feel we have something for everybody, but it's kind of like that old phrase, you kind of get what you're
That's what I was just going to say. You get what you pay for sometimes.
Yeah, it does happen that way. So these are some of the myths that we often hear all the time. We just kind of wanted to address them and help the viewing audience kind of get a better education in regards to that. Again, thank you very much, Jesse Hidalgo with Brandi, with our Derby location coming at you today. So we hope you found this video very educational, very understanding. And so if you happen to be in the area, give us a call. We'd love to be able to help you. Thank you for joining us.